fortuitous that I did my family medicine residency in Conroe, Texas, to know Rob Warner and Brad Pontani at the big wound care and hyperbaric center in Conroe. At the time, I didn't know that that's what I wanted to do. I wanted to do a little bit of sports medicine and family medicine. But when I finished my residency, I went up to Chicago and found that I knew more about wounds than a lot of people up there did, based on my experience with Dr. Warner and Dr. Pontani. And the wounds in the family practice clinic that I was involved in kind of gravitated toward me. And then an opportunity opened up in Dallas. I became the medical director of the brand new wound care center and hyperbaric center at Methodist Hospital in Dallas in 2003, and the rest is history, I guess. I'd tell them, the medical students who are possibly interested in wound care, that it's very rewarding from a visual standpoint. You actually see the patients get better versus treating chronic diseases like diabetes or heart disease. It's very difficult to see that improvement other than in labs or x-rays or things like that. You get visual reward and feedback almost instantaneously as the wounds get better. It's a fairly laid-back occupation, if you will, profession, because there's not a whole lot of urgent chronic wounds. So you're not getting some of the calls in the middle of the night. So it's also a little better lifestyle than some of the other specialties. So those are the two things that I would say go into it. But if you don't have a passion for wound care, then it's very difficult to succeed. You have to understand that treating wounds is more than just putting a dressing on a wound. It's actually managing the whole patient, because there's a lot that goes into wound care other than just dressings. You have to make sure that their nutrition's adequate and their diabetes is under control, and the infection's under control. So you're part infectious disease, you're part endocrinologist, you're part surgeon, if you will, if you're doing debridements. So it's a very broad, hands-on specialty.